everyone, I'm Dr. Ekta Bhushan, teaching anatomy and physiology, physiology of exercise and sports medicine at Indira Gandhi Institute of Physical Education and Sports Sciences, University of Delhi. I welcome you all to online lectures of CEC-UGC. In this series, we will discuss different topics associated with sports medicine. But today in particular, we will discuss the topic introduction and treatments of electrotherapy and infrared rays therapy. So, electrotherapy includes a range of treatments using electricity to reduce pain, improves circulation, repairs tissues, strengthen muscles and promote bone growth, leading to improvements in physical functioning. Electrotherapy units usually consist of a battery-powered devices connected by wires to adhesive electrodes, pads, which are placed on the skins. The electrodes pads are sticky, so they will adhere to the skin. Once the electrodes are attached and the unit is turned on, a mild electronic current is sent to the skin via the electrodes. So, a number of newer electrotherapies devices bypass the wires, combining electrodes and battery powered into a single unit that can be worn unconsciously on the back arm, leg or elsewhere during work or other daily activities. A handheld controller is used to adjust the level of stimulation. While a large number of people find electrotherapy helpful, others do not. So, the medical literature on electrotherapy's effectiveness has been mixed, and not all electrotherapy treatments are supported by research. So, electrotherapy uses electrical signals to interfere with the transmission of neural pain signals into the brain. It effectively slows down or distracts the message from the nerve to the brain. From a physiotherapy point of view, affecting one's pain gate, whether in an acute or chronic pain episode, is crucial area of treatment, and electrotherapy is a very useful resource where conventional medicines are not as effective. Electrotherapy can also involve the use of this electric current to speed tissue healing, where tissue damage has also occurred. So, let's start with the uses of electrotherapy. The first one is pain management, and it improves the range of joint movement. The next one is treatment of neuromuscular dysfunction, in which improvement of strength, improvement of motor control, retards muscle atrophy, improvement of local blood flow, then improves range of joint mobility, induces repeated stretching of contracted, shortened, soft tissues, tissue repair, enhances microcirculation and protein synthesis to heal the wounds, then restore integrity of connective and dermal tissues. So, electrotherapy is typically used in conjunction with other treatments rather than by itself. For people undergoing physical therapy, electrotherapy may alleviate pain sufficiently for an individual to participate more actively in targeted exercises. Electrotherapy is among pain relief options gaining attention as the potential risk and side effects of opioid or narcotic medications have become more apparent. So efforts to use electrical current to aid in a healing go back to ancient times. The modern era of electrotherapy in the United States began with treatment of anxiety and depression, and the number of potential uses has gone since. Electrotherapy has been used to address chronic pain and chronic fatigue in general, as well as diabetic, nerve pain, fibromyalgia, migraine, headaches, wound healing, stimulating bone growth. So electrotherapy can take many forms but the most common types of is transcutaneous electrical nerve stimulation. We also call that TENS therapy. While the concept of using electricity on the body may sound painful, many people find the sensation relaxing. The TENS, for example, the individual experiences a tingling, vibrating or buzzing sensation. So now let's see how does it works. So electrical impulses are capable of blocking pain signals carried by nerves throughout the body. Electrotherapy can help to release endorphins, which are the body's natural chemical method for controlling pain. Where atrophy occurs, electrotherapy can stimulate muscle tissues and reduce problem. Electrotherapy improves circulation and promotes faster healing. Electrotherapy can be used to reduce inflammation. Now, what are the different types of electrotherapy treatments? So there are different devices that delivers electrotherapy in different ways. In some instance, your therapist will place electrodes pads placed on your skin using adhesive that are connected to the specialized devices for generating an electrical charges. The pads are designed to transfer the electrical energy through the skin and into the body. Alternatively, your physiotherapist may deliver electrical waves to your body using a transducer that employs a special gel to transmit specialized ultrasound waves into your body. When you attend physiotherapy in any physiotherapy center, physiotherapist may employ a variety of different electrotherapy methods. Like the first method which we are going to study is electrical muscle stimulation. We also call it the EMS. While some methods of electrotherapy target nerves, EMS doesn't target nerves. It targets muscle tissues and is designed to contract them by exploiting the body's natural motor neurons. EMS is typically employed to treat atrophy. The next method is short wave therapy. Shock wave therapy delivers high energy acoustic waves, can be used with a transducer and specialized gel to release trigger points and reduce inflammation. Physiotherapists often use this method to treat musculoskeletal problems such as tennis or golfer's elbow. The next one is transcutaneous electrical nerve stimulation. We also call it TENS. So you have likely heard about TENS before. The physiotherapist will use a small device that delivers electrical pulses, stimulating nerves and reducing pain. So TENS is widely used around the world for a variety of painful conditions such as arthritis, low back pain, labor pain, nerve related pains. Then how does it work? electrodes which are placed on the skin in the area of the pain. This allows a small low intensity electric charges to be passed across the area. So we can use TENS in two ways, high frequency and low frequency. On a high frequency, by selectively stimulating certain non-pain nerves fibers to send signals to the brain that block other nerve signals carrying the pain messages. High frequency stimulation, sometimes called conventional, is tolerable for hours, but the resultant pain relief lasts for a shortened period of time. On the other hand, lower frequencies stimulates the production of endorphins, natural pain relieving hormones, your own built-in pain management system. Low frequency stimulation, sometimes called acupuncture-like, is more uncomfortable and tolerable for around 20 to 30 minutes, but the resultant pain reliefs last longer. So unlike many pain relieving drugs, TENS is not addictive and has few side effects. Most people can use TENS machines, but it is unsuitable for the people who has neurological disorders, patients with pacemakers and certain other types of heart diseases, unknown causes of pain, certain body sites in pregnancy, certain skin conditions. Now the next therapy is therapeutic ultrasound treatment. So this treatment causes a heating effect in the body's tissue such as tendons and muscles and promotes good circulation. It's often uses to speed up the healing and employs a transducer. Your physio might turn to therapy ultrasound to treat knee injury or to address tendinitis. The next treatment is interferential electrotherapy treatment. This method is sometimes referred to as IFT and uses to low frequency pulse to stimulate muscles and reduce pain. It's a better alternative than TENS for some patients. So it is essentially a deeper form of TENS. It utilizes two high frequency currents which are slightly out of phase and are passed through the skin at the same time, where they are set up so that the path cross the simple interference with each other. So this interference gives way to a beat frequency which has the characteristics of low frequency stimulation deep under the skin. So it is administered by a physiotherapist and involves the placement of damp sponge on the body which delivers a mild current. Similar to the sensation of pins and needles, manipulation of the current allow the therapist to target the correct structure and to treat. So there are four main clinical applications for which IFT has been found to be effective. The first one is pain relief in a similar fashion to TENS, muscle stimulation, prevent muscle wastage, re-education, maintain range of motion, increased local blood flow, reduction of edema, or we also call as swelling. So it also stimulating soft tissue healing and repair. So 5 to 10 minutes may be sufficient to achieve the effect. In other circumstances, it may be necessary to stimulate the tissue for 20 to 30 minutes. It is suggested that the short treatment times are initially adopted, especially with the acute cases. Now the next one is electroacupuncture. Just like traditional acupuncture, Electroacupuncture employs small needles instead inserted by the therapist at a strategic point around the body. Then the electrical current is passed through the needles traveling between the probes and to stimulate tissues. So now there are 6 benefits of electrotherapies which we can which are reduce nerve pains, promotes healing, have a non-invasive drug-free pain controller, prevent muscle atrophy, increases circulation of wound and repair, and I have a minimal to no side effects. So first one is reduce nerve pain. So those who suffer from nerve pain experience numbness, tingling, burning or muscle weakness and general pain throughout the body. Though the causes for nerve pain vary, the pain is attributed to your body nerves sending out electrical impulses that carry pain signals. The next one is promote healing of musculoskeletal injuries. So some electrotherapies modalities, especially a shock wave therapy treatment, have been shown to effectively treat a variety of musculoskeletal conditions. Not only can shock wave therapy reduces pain, but it can help increases blood flow to an injured area, which can stimulate the healing process. You might find these shockwave therapy in useful injuries like tennis elbow, plantar fasciitis, carpal tunnel syndrome or jumper knee, shoulder pain, etc. The next one is have a non-invasive drug-free pain control. So electrotherapies offers a safe, non-toxic and non-addictive way to handle chronic pain. Whether you suffer from chronic neck or back neck, you know that these conditions can make a difficult to perform activities of daily living and can reduces your quality of life. The next one is prevent muscle atrophy. So when muscles can't be used due to injury, illness or nerve damage, this can result in muscle atrophy, which is when a muscle wastes away. Not only those muscles atrophy restrict movement and impact quality of life, but it can also contribute to pain and stiffness. Fortunately, electrotherapy, especially electric muscle stimulator, that is EMS, can help prevent atrophy by stimulating muscles to contract. The next one is increases circulation for wound repair. So healthy circulation is an incredibly important aspect of the healing process. Oxygenated blood brings nutrients to our cells and helps jumpstart tissues healing. In addition, healthy circulation helps remove toxins from the body to create a healthier body. Then it has no side effects or very minimal side effects. So when it comes to electrotherapy treatment, most patients experience pain relief and healing with relatively few side effects. In fact, the most common side effect from electrotherapy can often be traced back to the adhesive used in securing the electrodes pad to the skin, which can occasionally trigger a rash or allergic reaction on the site. You may experience some slight discomfort during treatment, but electrotherapy is generally a pain-free methodology with no long or lasting side effects. Now we will come to the second part of this lecture, that is infrared rays. So infrared radiation therapy, also called light therapy, are used in physiotherapy to manage acute or chronic pain, mainly joint and muscle pain in patients. In this therapy, various wavelengths of light are focused to the part of the body that have injuries. A key characteristic of infrared light is that it has the ability to get below the skin layer and provide a much greater depth. So this in turn can be more effective in providing pain relief. This method of physiotherapy is natural and painless and can provide numerous health benefits without causing damage to the skin. So infrared, or we also call as IR or thermal radiation, is a band of energy in the complete electromagnetic spectrum. IR are the radiations of longer wavelength than the red end of the visible spectrum and extend to the microwave region. So infrared radiation is generated by sun. Many ancient therapies have utilized sunlight for wound healing and pain relief. When sun rays reach the ground, they get absorbed by gases or water molecules in the atmosphere. The human body is made up of 70% of water, so it can potentially accumulate a large amount of energy that could modulate biological process by strong resonant absorption of infrared radiation from sunlight mediated by water molecules. We can see in the picture the wavelengths of different ways: gamma rays, X-rays, UV rays, visible light, infrared and microwave, and radio waves, and their wavelengths also. So what is the purpose of infrared therapy application is to achieve, to decrease in the inflammation, pain control, wound care and tissue repair. Infrared generators. So the rays emitted from the luminous generator are produced by one or more incandescent lamps. An incandescent lamp consists of a wire filament enclosed in a glass bulb, which may be evacuated, may contains an insert gas and a lower pressure. The filament is a coil of fine wire. Wire is made up from tungsten, so the material tolerates repeated heating and cooling. Then the exclusion of air prevents oxidation of the filament, which would causes an opaque deposit to form the inside of the bulb. The passage of an electric current through the filament produces heat, infrared, visible and few ultraviolet rays. So the front of the bulb is red to the filter out the shorter visible and ultraviolet rays. Spectrum is from 350 to 4000 nm and wavelength is 1000 nm. So how does infrared therapy work? So infrared light has the ability to reach the muscles, nerves and even the bones because it penetrates the inner layer of the skin to the depth to the 2 to 7 centimeters. Hence, it amongst the most effective therapies used for healing and inflammatory conditions. So, infrared light gets absorbed by the photoreceptors in cells, which starts a series of metabolic processes, triggering natural processes to the body at a cellular level. It is estimated that the effectiveness of infrared therapy may be due to nitric oxide. So, it is a molecule that is important for the health of the body's arteries. Nitric oxide can help in relaxing the arteries, preventing platelets collection in the vessels and fighting free radicals to reduce oxidative stress and regulating the blood pressure. With all this, there is increase in blood circulation that provides vital nutrients and oxygen to injured body tissue. Therefore, this therapy speed up the repair and regeneration of injured tissues, which in effect reduce pain and inflammation. So, in this picture, we can see the depth and penetration of the infrared rays. Then absorption of rays into the skin, we have just seen in the picture also. So, close to 95% of the radiation applied perpendicularly to the skin is absorbed. Water and proteins are strong absorbed into the infrared. Any radiation entering into the skin depends on structure, vascularity, pigmentation of skin, wavelength of radiation. Now we will see the application of infrared therapy. At the time of exposure, the intensity is low. When vasodilation has taken place and increased the blood flow, the length of the radiation may be increased. Now dosage is, duration should be is 10 to 15 minutes during the day several times. Voltage of emitter of apparatus should be 250 to 1000 watt, or wavelength should be 800 nm to 1200 nm. So it is very useful as far as therapeutic effects are concerned, are pain relief, reduction of muscle spasm, joint stiffness, edema, skin lesion, derma ulcer, etc. Increases the sensory nerves conduction velocity, increase the endorphins, increase the blood supply, increase the joint ability and muscle relaxation. So now we have come to a conclusion. So electrotherapy is the use of electric energy as a medical treatment in medicine. The term electrotherapy can apply to a variety of treatments, and infrared light therapy harnesses the healing power of infrared wavelength of light. So I hope you understood the introduction and treatments of electrotherapy with its various types of infrared rays therapy in details. So that's all for today. See you next time. Thank you.